back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. And you can also visit the playlist. In the playlist I have provided all the topics so far we have discussed in a very systematic order, so you can make use of it. Anyway, my dear friends, since last 8 or 9 part we have discussed some of the basic understanding of the doshas. Okay, so how this Purusha Prakriti has to be understood, and what do you mean by Panchamahabhuta theory, and then how we are connected with the nature, how the same energy which is present in the atmosphere or present in the universe is also flowing inside our body, how it is replenished, how it is decreased, and what is the importance of ahara, and what actually we have to understand by doshas, sthana, hetu, etc. So all the basic parts we have covered. Now we actually come to the very complicated part of the doshas. So when I say doshas, so now this has to be the following parts has to be understood very clearly, for which the basic understanding is very much important, which we have covered in the last 8 parts, and now onwards we are totally discussing on the clinical aspects. So if you understand this part clearly, then it is quite easier to implement these principles of doshas in the treatment. Now let us start with that. So actually what create confusion in the doshas, understanding of the doshas, what the factor which create the confusion. Now, for example, I will take the first example, Shaitya and as well as Supti. So if you go through this particular table, so which I have seen the last time, yes, that table is somewhere here, where it contains, yes, okay, so these are the these are the, what you say, the gunas which are present in the different doshas. So here also we can see some of the overlap. Okay, now similarly here also we will find another important thing, that is Shaitya and Supti. Okay, Shaitya and Supti. So basically these are the two gunas, Shaitya and as well as Supti. These are the two gunas which are seen in Vata and as well as it is seen in Kapha. If you see Kapha, there also this Shaitya will be there, and in Vata also Shaitya is there, and Supti is there in Vata also, and Supti is there in Kapha also. Now here we have to understand very clearly what is that Shaitya. So what is the exact meaning of Shaitya? Shaitya means an area which usually looks wet or cold or moist, and if it get converted into a rough area, and get dried up to attain the Aruna Varna. Okay, now see, just try to understand the actually word meaning of Shaitya is the area which is usually looks wet or cold or moist. That same area, if it is get converted into a rough area, so how it can be converted into rough area? Because if the wet portion has been get dried up, then it will be get converted into a rough area, and it dried up and attains a Aruna Varna. There is a typical color change, maybe a blackish coloration, whatever, Aruna Varna. So then it is due to Vata. Okay, so Shaitya, okay, the Shaitya. So we are talking about Shaitya only. So basically the first part of Shaitya, that is because of the Kapha. Okay, when it gets dried up, that is because of the Vata. So if the area becomes moist, oily or whitish or pale or blanched, then it is due to Kapha. Okay, then it is due to Kapha. The same area, if it get dried up and get converted into the Aruna Varna, then it is because of Vata. So Shaitya is possible. Okay, so now differentiation is made by considering the other features. Now how to differentiate these two things, Shaitya and Supti? So differentiation is made by considering the other features. Supti means exactly what they say is, Supti means Sparshahani. Okay, whereas because of Supti, when it is occurring because of the Kapha, that is called as Sparshahani. Whereas the same that Supti which is occurring because of Vata, then there will be Kriyahani. Okay, so one is there is a Kriyahani and another one is there is a Sparshahani. So these are the two important things now, Shaitya and Supti. Both are seen in case of Vata and as well as Kapha. But the phasic changes, we can say phasic changes. Okay, same, it get dried up, it becomes Supti. Another is Stambhana. So we'll take another example. Similarly, Stambhana is seen in Vata karma and also in Kapha karma. Stambhana is also the function of the Vata karma, or the same Stambhana is also because of Kapha Vriddhi. Now, Vata acts as Stambhana due to its obstructive quality, while Kapha acts as Stambhana because of its Sthira guna. Okay, in Kapha, Stambhana is there because of the Sthira guna of the Kapha. Whereas in Vata, the Stambhana activity occurs because of its obstructive quality. Vata can obstruct so many things. Because of that obstructive quality, the Vata get the Stambhana guna. So, Vata Stambhana causes splitting pain, headache, and other painful situation, because that is happening because of the obstruction. Okay, because of obstruction, the Vata causing the obstruction. Vata itself is causing the obstruction. So there will be Vimargamana or so many other Rasa Sangas, Sangha, Vimargamana, etc. is happening, or Ati Pravritti may be happening. So because of which there is so many clinical presentation, like headache may be there, splitting pain will be there, or the squeezing type of pain may be there. Okay, so that is the Stambhana which is occurring as a result of Vata karma. Okay, while Stambhana which is occurring because of Kapha, always devoid of pain. In Vata Stambhana you will have pain, whereas a Stambhana which is occurring because of Kapha, there is no pain. It is devoid of the pain, or there may be less pain along with other Kapha Lakshanas. For example, you take the growth of the tumor. So when you take the growth of the tumor in any particular lumen or any what is a lumen or any luminar that means hollow substances, wherever in the pathway or in the shrotas, when there is a tumor is growing, also there is an obstruction, there is the Stambhana, but the Stambhana is very less painful. Okay, or in the later part when the compression starts, it may be painful, otherwise no pain is there. Although there is Stambhana, there is no pain. That is usually seen in case of tumors. So that is this type of Stambhana, that is because of the Kapha Stambhana. Whereas Vata Stambhana, most of the time it causes pain, colicky pains, etc. Okay, so this is one important thing. Whereas the swelling occurred due to Stambhana guna of the Vata. Now the pain part we have seen. Now just go for the swelling. Swelling which is occurred because of the Stambhana guna of the Vata, the pit of the swelling quickly disappears. Suppose if there is a Stambhana of Vata guna, and as a result there is Vimargamana or Ati Pravritti, and as a result there is appearance of Shota, suppose. Okay, Rasava Shotas or Udakava Shotas, there is obstruction by the Vata, and that leads to the Shota. Now, if it is because of Vata karma, okay, that the swelling is because of obstruction of the Vata, then there is a pitting type of swelling will be there, and that disappears very fastly. Whereas same swelling which is occurring because of Kapha Stambhana, there the pitting, okay, when you press, so that will disappears very slowly. It slowly get filled up. Okay, so usually dependent edemas, what we say, dependent edemas will be there, shows this particular property. Where lymphatic edemas or some other fatty edemas, so they will not show this particular property. So they may be taken as a Stambhana because of Kapha. Whereas this pitting type of edemas, dependent edemas, so they can be taken as a Stambhana guna of the Vata, leading to obstruction. Okay, so usually a swelling in the Vata on pressing gives the comfort, while not in case of Kapha. This is another important thing. Whenever there is a swelling and also little pain, and if you just press it, it will give some type of comfort. Whereas a swelling which is occurring because of the Kapha Stambhana, that will not give any much comfort. Okay, now you take the example of Urustamba. In the Urustamba, Vata Gati Rodha is there. Okay, if you take the example of Urustamba, Vata Gati Rodha is there. So that means obstruction to the Vata is there. Therefore, in case of Urustamba, we will get Stamba and as well as Shula. Both will be there. Okay, so Shula will be there. Okay, Shula will be there. That is because of the obstruction is because of Stambhana of the Vata Stambhana. Sorry, the presentation is because of Vata Stambhana. leading to obstruction. Similarly, Margavajanya Rakta Vatarakta. You take another example of Margavarodajanya Vatarakta, where Gati Roda of the Vayu is there. That Gati Roda of the Vayu is due to Kapha and as well as Meda. Okay, so here also see Margavajanya Vatarakta. What actually happens is there is Gati Roda, obstruction to the movement of the Vayu due to Kapha and as well as Meda. Okay, so usually in case of Kapha, you should not have much pain. If it is because of Vata, you should have pain. But in case of Kapha, you will have less pain or no pain. So therefore, in case of Margavajanya Vatarakta, usually this is an exception, you can say. In case of Margavarodajanya Vatarakta, a slight exception is there. There is Shula and as well as Supti, both will be seen. Shula and as well as Supti, both will be seen. Okay, Supti we have discussed last. In the last slide we have discussed Supti, why it happens. A moist area become dried up. Okay, that's the reason. So this is about some of the important things related to Vata and Kapha. Okay, Shaitya and as well as Supti and Stambhana. Stambhana can occur because of Vata and also Kapha, and how to differentiate it clinically. So that is very important. I tried to give some examples and to make you realize. Thank you very much. In the next class, we will go with some combination of two other doshas. Okay, so which create confusion in clinical practice. Thank you.